Hello everyone, hope you're all well. Welcome to my YouTube channel, Basic Obs and Gynae Teaching. So today we are going to talk about basic testicular examination. So especially if you're doing fertility, it is important to examine the male patients if there are any issues with the semen analysis. So like any examination of a body, inspection and palpation are the important parts. So after you have taken the history, checked the semen analysis, checked all the bloods or requested all the bloods, genetic testing if needed, then you will proceed for examination. You will ask the verbal consent, have a chaperone, and you will need to examine the patient lying down as well as standing up. So patient should be comfortable, exposed properly, and then covered with sheets from top to bottom, just exposing the genital area. And then the first part is inspection. So you will see on inspection, what are you noticing? How is the skin? How is the hair pattern? How is are there any swellings, any obvious redness, any obvious discharge or lesion on the skin? Sometimes you will get patients who have got horrible eczema which has affected their penile skin. Sometimes they will have a very obvious hernia in inguinal region, or a large swelling in the scrotum, or a lesion on the glands if they are circumcised, or a discharge or a bleeding. So that will be your inspection. Then palpation. Again, you will warn the patient first that you are now going to examine them. The deal is that you would first stabilize the testes with one hand, and with other hand you will examine, and you will have a feel of the testis, the size of the testis, if there is any tenderness, what is the consistency of the testis. And once you've done that, you will move at the back of the testis to feel for the epididymis, and then you will go right at the top to find the spermatic cord, and you roll it between your fingers, and then you can feel for the vas deferens. Same thing you will repeat on the left side. So again, feel for the consistency, size, any particular hardening or any lumps or bumps. Feel for epididymis and cord on either side. Then you have to lift the scrotum and inspect the perineum if there are any fistulae, fissures or any other lesions. Same thing you will do with the shaft as well. You lift the shaft. If they are not circumcised, you retract the skin, inspect the glands for any lesions, and then based on your findings, you got an orchidometer which tells you about the average size of the testicle, so you can sort of guess what is the size of the testis, and then you will explain the findings to the patient, and based on your findings you will request further investigations, which will be ultrasound of the testis, hormone profile which will contain prolactin, testosterone, LH, FSH, and genetic testing in case of severe oligospermia or azoospermia, which will include a karyotype, cystic fibrosis mutation, and Y chromosome microdeletion. Although the new guidance by NICE says that if you can feel both the vas deferens, then probably no need to check for cystic fibrosis mutation.